And welcome, everyone. It's so nice to be out of the snow of Philadelphia and in the sun of Tampa. Boy, you know, you could get acclimated to the weather here real fast. I'm here today to honor care partners and caregivers. As you probably know, November is National Caregivers Month in America. So I'm going to be demoing and teaching you fast, effective, and fun ways to reduce stress. If there are care receivers here today, those of you coping with MS, you too are certainly welcome and will benefit greatly from these techniques. Relaxation and guided imagery are gentle yet powerful mind-body techniques that have been well proven and documented to help people with autoimmune disorders like MS to reduce stress, lower anxiety, renew energy, lower depression and mood, increase fatigue, and improve coping. I now have a guided imagery app called Imagery Work, and I have an entire page on the app dedicated to guided imagery interventions just for MS. I have gone across the country teaching these techniques, so I hope today you'll have some fun and you will practice this with me in a little bit. First, I'm going to review caregiver stress and stress. So let me ask the group today a question. Why do caregivers or care partners have so much stress? And notice, I didn't ask, why do they have stress? Stress is part of life. Life is full of change. So we all have stress in adapting to constant changes in life. And we're built for stress. Humans are high up on the evolutionary chain. We're great at adapting and coping with life's fluctuations and creating strategies and problem solving. So, why do care partners have so much stress? So, to answer that, there were two very large studies done in the States on caregiver stress. One is from NARCOMS. Some of you may have heard of NARCOMS. It's an organization that every few years produces research on MS, and they do studies on MS caregivers. The other is the largest, most comprehensive study done on caregiving in America. It was done in 2010, and it's called the EverCare Study. It was published by the National Alliance for Caregiving. So both studies found compelling evidence that caregivers were found to have stress, depression, and declining health in their roles as caregivers. In the EverCare study, there was a lot of information about how this occurs. It indicated that 21% of American households contain at least one caregiver, and that pervasive stress, worry, and sleep deprivation led them to neglect their own health. Now, and self-care was defined by skipping dental appointments, not going for regular medical checkups, not taking that walk in the park, not doing daily exercise, sometimes declining social support, and other forms of self-care. In this large study, 91% also reported a decline in their general health. 81% indicated that caregiving made pre-existing depression worse. 50% reported that their stress impedes their ability to provide care. And most importantly, 82% reported that their doctors or their care recipients' doctors who were aware of their caregiving role, only half report the doctors suggested any ways they could take better care of themselves. So the number one complaint in these studies was that participants identified stress as the most pervasive health problem in their lives as a result of being overwhelmed with caregiving responsibilities and being worried about their loved ones or their care recipients. Now, stress was expressed in a number of common ways, including headache, backache, increased blood pressure, sleep deprivation, heart attack scares, and flare-ups of health conditions. As you all probably know, stress exacerbates everything. Any condition you have, add stress to it, and it worsens, at least temporarily. So, the big picture. The gross majority indicated that they had insufficient relief from stress and often lacked financial support and other resources, sometimes social support, and then these two all reinforce their stress responses. So the toll of caregiving is enormous when there is insufficient relief from stress and a lack of resources. And it's estimated by 2030, there will be a national shortage of paid direct care workers and unpaid family caregivers. So what do care partners want? In these studies, they indicate that they want support services that, 1, save them time, 2, reduce stress effectively and quickly, 3, enable them to manage their own health more effectively, and 4, 4, they don't have time to attend community programs. What are the existing resources for care partners or caregivers? Well, most resources are provided by nonprofit health organizations like this one, the MS Foundation. They focus on teaching tips for stress reduction, and they provide information and resources. If mind-body techniques are taught, they're usually limited to belly breathing or diaphragmatic breathing, which is very good, but not enough. Or you focus on affirmative thoughts, like in a moment, I'll be calm. But typically, repetitive exposure to deeper states of relaxation and letting go of stress stored in the body does not occur. So, relaxation and guided imagery are gentle yet powerful mind-body techniques that teach people how to first become deeply relaxed in their bodies, let go of stress stored in their bodies, and then in that heightened relaxation response, if you add sensory images, even simple ones in the beginning, like imagining an ideal place of relaxation with your senses, which for most Americans is the beach, right? What happens is you can develop deeper stress reduction, well-being, healing, and problem solving. So, relaxation and guided imagery is actually used by holistic nurses in this country. I was certified by the American Nursing Association holistic nurses in these techniques. They typically only have 1 or 2 meetings with a patient to teach them how to prepare for surgery, how to reduce injection anxiety, how to stay calm on a transfusion, how to befriend a breathing tube. It's a natural, non-invasive, empowering method. It's versatile. It's inexpensive. It can be practiced almost anywhere, although I ask you to please not do it while driving. People tend to close their eyes. It can be taught easily over the web, live, one-on-one, in groups. You can practice it alone. It can be used by almost anyone. I teach people with mild to moderate dementia these techniques because they still have good sensory processing and sensory awareness. It doesn't matter what level of education you have, whether you're spiritual, religious, secular. In fact, you don't even have to be a believer for it to work. And unlike addiction, the more you practice it, the less you need. You can start with some initial practice and then weave in and out of using it. It's still effective. It's fast and powerful in its effects, and for most Westerners, it's easier to use than traditional meditation as it requires less time and discipline to develop a high level of skill. One of the great things about it is it's fun, it's playful, it's imaginative. It creates a locus of control within us. This lowers your sense of helplessness and reactivity. It increases your responsiveness. It also enables you to rehearse and prepare for challenging medical procedures, challenging tasks ahead of you, or just coping with challenging individuals. And it can produce very rapid shifts in attitude, perception, and behavior because it's not focused on your left brain. It's not focused on thinking about problems, analyzing your thoughts or your behavior. You know, the left brain is associated with logical, sequential reasoning. Most problems with mood and emotion have very little to do with rationality. Right? In a deep state of relaxation, you usher in the relaxation response. This means that you expand blood flow, lower blood pressure, reduce muscle constriction, tension, use slow heart rate, breathing rate, and you develop what's called a present focus or a meditative focus. If you then add sensory images to this state, wonderful things start to happen. Your right brain processing gets spruced up. This is the part of the brain that is associated with creativity, heightened intuition, being more responsive and open to experience, symbolic reasoning, emotions and the unconscious, and sensory processing. So when you spruce up your relaxation response, and then you add sensory images, it's the way the body gets it. And I'll demonstrate this in a little bit. Research studies have shown that relaxation and guided imagery is great for reducing anxiety and depression, to shift pain experience, reduce tension headaches. There are great studies coming out of Israel that demonstrate it's extremely effective for reducing pain, fatigue, and depression in rheumatoid arthritis. Same thing with Parkinson's, but it also reduces tremors. There are big studies being done on fibromyalgia. It's been known more than any other mind-body technique to improve short-term immune function. It lowers MRI-related anxieties. I have a track of that on my app. Lower blood pressure, prepare you for infusions, chemo, surgery, and it increases memory rehearsal in post-stroke survivors. There are a number of studies that have been done on relaxation and guided imagery for MS. The first one was in Pennsylvania in 1996. McGuire found that if he taught a group of MS patients these techniques over weeks, they significantly reduced anxiety. Sutherland found in 2005 that she could use these techniques to increase vigor and energy and improve quality of life. I did a series of studies across the country in 2008 where I used these techniques to lower anxiety and injection anxiety with MS, and I found a extremely high result, positive result, that even weeks after the workshop, injection anxiety and anxiety were considerably lower. And there was a great new study done this year, 2018, in Southern California by Case and her colleagues, where they used relaxation and guided imagery with both a control group and a pilot experimental group, and found that those who were exposed to the relaxation and guided imagery had significant decreases in mood, fatigue, anxiety, and improved quality of life. So before we start practicing these techniques, and I'm waiting till you're done with your main entree because it's a little easier to do it between, munching. Let me ask the group a question. Who taught you how to relax? So usually when I ask this in groups across the country, I get a long, hushed silence, and then somebody whispers, no one. It's interesting. So it's wonderful to learn how to be deeply relaxed and still conscious by using these techniques. And it's terrific for care partners or caregivers because the problem, as I mentioned earlier, is not having stress, but how do we lower stress when stress piles up physically, emotionally, or socially, especially when stress is sustained over long periods of time. So again, we're built for stress, but we don't typically know or are taught how to keep lowering stress when we don't need to stay in that state. So I'll give you an example. Let's say you're walking down the street and you're alone. And across the street is a Bengal tiger who has escaped from the zoo. The tiger locks his gaze on you, lowers his head, emits a low growl, and starts moving quickly, rapidly towards you. What do you do? Well, apparently, you're supposed to feign being dead and lie still, but I'm having no parts of that. I'm running like the Dickens. I'm not hedging my bets, right? So what happens immediately is that whether you hear, see, or smell danger, your adrenalines, your corticosteroids are immediately emitted into your bloodstream. Your natural sugars, glucose, your proteins that are in short-term storage also get distributed quickly into your bloodstream so that your heart rate speeds up, your breathing is faster and shallow, because you really don't need to be eating at these times, and you want blood to leave the digestive tract so that large volumes of blood can be pumped down into the limbs and you can run and escape danger. That's called your natural survival fight or flight response, or what some people refer to as heightened sympathetic nervous system arousal. We've all got it. So, you run. Along the way, you nick your arm against a tree branch. You bleed, but you don't feel it because you're still in this heightened fight or flight state. You find a tree. You hop up to the top. From above, perched on high, you look below and observe the tiger. Zookeepers arrive, sedate the tiger, and start to drag him away. What should start to happen now. Danger is over.
He has a brother.
He's got a brother. That's the problem with being human. We got to make meaning out of everything, right? So what should happen is that you should now kick down into very low states of what we call parasympathetic functioning. It's always on, it's heightened during sleep and rest, but you now need to go down to slower heart rate, deeper diaphragmatic breathing, release tension in the muscles, start renewing cell repair and renewing energy, and putting nutrients again into long-term storage. Now, zebras and other animals do this too. If a zebra's out on the African plains eating grass, and a hungry lion jumps out and starts chasing them, they go immediately into high gear sympathetic arousal, fight or flight. They don't need to be eating at this time. They gotta run. If they escape the hungry lion, they immediately kick down into heightened parasympathetic functioning and go right back into eating grass. Okay? But zebras don't get ulcers. People do. They just automatically kick down. What people do is we have to make meaning out of what happens to us and what we're experiencing. And we have to store memories and emotions because we have to keep learning how to live, how to cope, develop new strategies, and we got to keep learning to shift between higher states of stress to lower ones, back and forth, back and forth. If we don't kick it down enough, stress pileup occurs. It can be holding on to tensions in the body, mental stress, or emotional stress, or all three. So understanding this, in fact, in biofeedback research, it's been found that learning how to weave back and forth into higher states of stress response, kicking it way down into the relaxation response, just weaving back and forth tightens immune function. In other words, you don't always have to be deeply relaxed like a lake with no ripples to be benefiting from these techniques. Understanding this, we can teach ourselves to become deeply relaxed and how to kick our stress back down by first relaxing our body. Not emptying our minds of thoughts, which most stressed and anxious people find very difficult to do. You have to relax the body so it can cup emotions and the mind will gradually follow. You never get rid of the movies of your mind. You can be deeply relaxed, think about something on your shopping list, and then kick down again. You can be deeply relaxed, hear somebody breathing and distracting you, and then you kick back down again. You can be deeply relaxed and thinking about an in-law, and then kick back down, okay? You don't have to clear your mind with each breath, which is often associated with meditation. You also don't have to, like in most forms of meditation, keep observing and telling yourself things will pass. Sometimes you need to be in a deep state of relaxation and just stay there for a while, because it's what you need. So, I can see some of you are getting between the entree and the dessert. So, the most important takeaway is that in this state of relaxation with guided imagery, your mind does not discriminate from the imagined image, scene, or idea. In other words, your body treats the imagined image as if it's happening. So, if your ideal place of relaxation is the beach, if you're very visual, you may see where the sea and the sky meet at the horizon. If you're very auditory in your processing, hearing, you may hear those seagulls chirping or hear the quiet, syncopated lapping of the waves against the shoreline. If you're highly kinesthetic, touch, pressure, dimensionality, you might feel the warm rays of the sun on your back or the sand beneath your toes. It doesn't matter if you have one sense going or all 5. Under the right conditions of relaxation, you add sensory images, you practice this, the body starts treating it with the healing, serene effects of being at the beach. It's like learning to turn on your own natural pharmacy. And the more you practice it, your body keeps getting it like deep depth charges. It keeps reverberating deeper and deeper in your system. So when we practice these techniques, we experience images in the right brain as very vivid, very immediate, and more emotionally charged. This creates a sense of a lived experience, a whole felt body state. So we're more able to make shifts in our perception and our behavior because we're interacting with the sensory images naturally. Also, in this state, your neuropeptides and your neurotransmitters flush longer through your system. When we apply this to a specific focus, we have an awesome ally, a way to experience a source of internal strength and skill in approaching a goal or sustaining long-term coping and adjustments that caregiving requires, or really coping with any situation that requires constant fluctuating adaptations. So, are you all ready to try it? Yeah? Good. Perfect timing. All right, I'm going to demo my De-Stress 101. This is my basic entry-level exercise. It's a free download on my app. It's a great way for most people to start. And I'm going to talk you down into a deep state of relaxation. If you find that you feel heavier and heavier, or lighter and lighter, or it varies from time to time, whichever way you go is fine. If you tear up, feel like you've got to clear your throat, you've got to sneeze more, these are often associated with heightened parasympathetic states. Please don't worry about it. If you become distracted or some unexpected pocket of emotion shows up, all you have to do is take a deep breath, exhale slowly, and continue on. Though it sounds un-American, it's really not necessary to work at relaxation. It kind of happens naturally on its own accord. Some of you will have your body get very relaxed and the mind's still going a mile a minute. Some of you, the mind will slow down. It really doesn't matter. The more you practice it, you'll start to see what your own tendencies are. The idea is to do it, see what it's like, and we'll discuss it. And then if I have time, I'll do another one, a short one, of going to a safe place. So you ready? I don't think I'm going to dim the lights, but I'm going to ask you to close your eyes just because it's so distracting otherwise with the light, the sounds, the activities of the room. Okay? Now, if you can, get as comfortable as you can in this room. If you can support your head, neck, and spine, great. And women, though you love to cross your legs, if you really want to do it, go ahead. But usually if you don't cross your arms and your legs, you have more expansive blood flow. Okay? You all ready? Okay. Find a comfortable position and close your eyes. Take a deep, refreshing breath at your own pace. And as you exhale slowly, feel a deep letting go. Take yet another cleansing breath. And as you exhale slowly, just feel a deep letting go. Take yet another refreshing breath, and on your exhale, just feel a deep letting go. It's a wonderful feeling to be deeply relaxed. It's a very healthy state of being. As you let go of the sights and sounds and activities of this room, I'm going to count from 10 to 1. On every descending number, just feel yourself going deeper, and you'll experience a deeper, more relaxed level of mind. 10, 9, feel going deeper and deeper. 8, 7, 6, deeper and deeper. 5, 4, 3, deeper and deeper. 2, 1. You're now at a deeper, more relaxed level of mind. To help you enter a deeper, more relaxed level of relaxation, imagine relaxing your eyelids. Relax your eyelids. Feel how relaxed they are. And allow this feeling of relaxation to flow slowly downward throughout your body and all the way down to your toes. To help you enter deeper, more relaxed levels of mind, I'll direct your awareness to different parts of your body so that you may release and relax and place and support each part of your body into a deep state of relaxation, getting deeper and deeper as you continue. Focus your awareness on your neck, the muscles of your neck, and feel a deep letting go. Focus your awareness now on your jaw, on your tongue, and release and relax and let go of any subtle tension in these parts of your body, placing each part of your body now into a deep state of relaxation, getting deeper and deeper as you continue. Focus your awareness now on your right shoulder, on your right arm, all the way down to your fingertips. And relax your right shoulder, relax your right arm, down to your elbow, your wrist, your hand, your fingers. Let any tense, tired feelings now just flow out of the fleshy tips of the fingertips of your right hand. Focus your awareness now on your left shoulder, on your left arm, all the way down to your fingertips. And relax your left shoulder, relax your left arm, down to your elbow, your wrist, your hand, your fingers. Let any tense, tired feelings now just flow out of the fleshy tips of the fingertips of your left hand. Now take a deep, refreshing breath, and as you exhale slowly, just feel a deep letting go in your chest. Good. Focus your awareness now on your back, the muscles and ligaments that go all the way down the small of your back. And release and relax. Place and support your lower back into a deep state of relaxation, getting deeper and deeper as you continue. Focus your awareness now on your stomach and abdominal muscles and feel a deep letting go. Focus your awareness on your pelvis and feel a deep letting go. Focus your awareness on your right hip, on your right leg, all the way down to your toes. And relax your right hip, relax your right thigh, your knee, your calf, your ankle, your foot. Playfully imagine now a little door at the bottom of your right foot that you can open. And let any dense, tired feelings just pass through that little door and into the air. And when they're gone, just close that little door. Focus your awareness now on your left hip, on your left thigh, all the way down to your toes. And relax your hip, your thigh, your knee, your calf, your ankle, your foot. Imagine now a little door at the bottom of your left foot that you can open. And let any dense, tired feelings just pass through that little door and let them evaporate into the air. And when they're gone, just close that little door. Just feel and see how relaxed you are from the tips of your toes to the tip of your head, and enjoy this deep sense of peace. It's a wonderful feeling to be deeply relaxed. It's a very healthy state of being. To help you enter deeper, more relaxed levels of relaxation, I'm going to count from 1 to 3, and at the count of 3, imagine yourself in your ideal place of relaxation, any place you feel serene or relaxed. Just imagine yourself there with your senses. 1, 2, 3. Imagine yourself in your ideal place of relaxation. Go ahead, take your time. Relax, take a deep breath, and go deeper. In a moment, I'm going to count from 1 to 3, and at the count of 3, picture someone easy to love, any person or pet. Just remember a time when love flowed easily. 1, 2, 3. Picture someone easy to love. Let this love gently surround you. Let it fill your inner core with joy and peace. In a moment, I'll count from 1 to 5. At the count of 5, gently with soft eyes, you'll bring yourself back to the sights, the sounds, and the activities of this room. 1, coming up slowly. 2, take a brief moment to review how good it feels to use your breath, your imagination, and your senses to relax, cope, and heal. 3, at the count of 5, you'll open your eyes 4, and 5. Eyes open, alert, refreshed, renewed, relaxed. How you all doing? Well, you also just ate. Who feels relaxed? Great, great, great. Okay. How do you know? What tells you that you are? I mean, you may not have been particularly at high stress before you started this meal, right? So what tells you that you're relaxed? How do you know? Anyone? Yeah. Heart rate slower, okay. Anybody start to feel very still but heavier and heavier, like rooted into the chair?
The pain that I was feeling erased.
It went away temporarily, yes. She's not a plant. This is a very common effect of relaxation and guided imagery. In fact, this particular basic exercise is great to do before going to bed. If you have insomnia or you have pain and wake up, you can practice this, shift the pain, and then roll over back into sleep. It's great for reducing tension, headaches. I have actually very specific guided imagery interventions for chronic pain. But yes, it is. Anybody feel the muscle tension in some part of their body, just more subtly relaxing, releasing? Yeah, a lot of nods. Okay, okay. And how many people went to the beach? Now, it doesn't matter if it's a favorite beach. It doesn't even have to be a beach you know. It could just be some beach you need to go to now. The body doesn't discriminate. This is a wonderful thing. You don't have to be there to have the effect. Right? How about picturing someone easy to love? How many people felt, saw, or heard their dog or cat? Right. And for parents, notice I didn't ask you, picture who you love the most. This is sensory. I just asked you to picture somebody. It could be their face, it could be their whole body, you could just feel them lying next to you, you could feel their hand. It's just someone in a sensory way that's easy to love. By the way we carry people and internalize them when they pass is through our senses. So when I prepare people for surgery or for long, difficult tasks where they have to wait and hold the long whiles and during, I always evoke picturing people that are easy to love, a band of loving allies around you. Because it helps you contain, not just relieve and soothe in experiences. So the great thing about practicing these techniques is first you learn how to lower stress and anxiety or reactivity. Once you get used to it, you like it, and you improve well-being, then you can go back in and interact with things that are upsetting because you know how to lower the reactivity, then go back in and interact with it. Okay? Any questions before we go on? Yes?
Can we get a tape or recording?
Yes,
of this?
yes, yeah. You have my postcards. If you download my app, and it doesn't matter what kind of phone you have, it's called Imagery Work. When you download it, the De-Stress 101 will be on an icon on the side. You push it, you can listen to it. That's a free download. If you want all my other guided imagery tracks, my blogs, my videos, you have to subscribe. It's $2.99 a month. Okay? Now, and this is a good one to start with. Now, what you can do is, as you practice the De-Stress 101, even if you get very used to it, even if you start to trail in and out, not listen to my voice, it's totally, perfectly normal and fine in a right brain, relaxed state. You don't have to listen to every word with conscious intention. The body keeps getting it. So then, maybe you're at work, or you're waiting in a doctor's office, or you have one of these stolen moments or underutilized therapeutic windows in the day. Take a couple of slow exhales. Take the part you like from De-Stress 101, like picturing someone easy to love or imagining an ideal place of relaxation, for about a minute, and then go right back to whatever you're doing. Time in the mind in these states isn't like regular external temporal time. Now you all know this. When you're sitting at Thanksgiving with somebody you love, 4 hours feels like 5 minutes. And when you're next to somebody you can't stand, 5 minutes feels like an eternity.